Welcome to Be the Category of One. I'm Jenn Brown, leadership coach and COO. This podcast is about growth, mindset, and leading the way by choosing to stand apart in how you think, how you lead, and how you serve. Hi, Angela.
Hello, Jenn.
How are you?
So excited to be with you today.
Me too. I want to say Happy New Year, but I keep seeing from Larry David that after the 7th of January, you cannot say Happy New Year anymore. So I feel like I need to withdraw that. So happy Friday. Happy Friday.
Happy Friday. I love that.
Thanks for joining me on our first podcast. We're so happy to have you. I'm excited about all the things that we're going to talk about today.
So very excited, and to be first is such an honor. Thank you so much. But yes, look at what you have coming for 2026. So exciting.
So just a little bit about you. Angela Ward is president and CEO of Toothwares LLC, a Texas-based dental practice consulting firm known for her deep expertise in practice systems, emotional intelligence, and team performance coaching. She's been a great partner in helping train our team over the last year, and I'm sure many others.
You have an amazing team to work with. First of all, amazing team, amazing leadership with a vision of health and wellness that just resonates with my passion. So it is such a pleasure to work with you all.
Great. I love hearing that. It makes me excited for 2026. I was thinking about when I was driving here today, what drew me to look for someone like you. And I did look. I wasn't, internet shopping for you, but I was looking for someone who could bring what you're bringing to us, to the practice. And the reason why, I don't know if I told you this story, I think maybe at one point we talked about it, but one of the reasons why I was looking for you was to come in and help us view our insurance companies that we're in network with, that we're in contracts with, right, and decide, is that the way we should be treating patients in the future? Meaning, for those of you who don't understand insurance companies, on some level, while it's a great thing that our patients have insurance coverage, dental coverage, for a provider or an organization like ours, oftentimes we're being directed on how to care for patients or what to do for patients based on what whoever is making the decisions in those companies want to pay for their patients, for their the people that they cover, rather than being invested in what's best for someone's oral health. So us looking at the companies that we are in network with and that we do work with was something that actually drew us together, right?
Right. That's what we started with.
And, I'm not afraid to name drop, but especially Delta Dental, because they're one of the largest companies right now that are really interfering in how providers feel that their patients should be cared for. And they're making it very hard for providers to do their job well. But anyway, so we met, we started talking about Delta, and then all these other beautiful things came up in learning about your skill and your passions and what your really, I'll call it your unique abilities were. And we've kind of taken a little side.
We have a side journey right now.
Which is great. Great.
You're right. But yeah, so often it's so hard to understand insurances, but they serve their purpose. But it is not to keep you healthy. It is to help you make decisions, help you to pay for the decisions you want to make for your own health. Do not let insurance dictate your treatment. You're right. They will limit your care. And it's not the care necessarily that's proper for you. Your healthcare provider, your dentist, your hygienist, those are the folks that you align yourself with. They will guide you based off of your clinical findings. Insurance can help you. Don't rely on it 100%.
Exactly. One of the things that I find interesting when I'm looking at insurance companies now and talking to my team about I'm calling it financial transparency in 2026, which is really educating our patients about their coverages and what they will pay for and what they may not pay for. But one of the things that I find really interesting in that is that oftentimes the struggle for us is that our patients view us as part of the insurance company.
Correct.
Where we're just trying to treat, again, my husband started the practice 43 years ago with the intention of treating people like family and creating an expectation that, an experience that exceeds an expectation. And that doesn't really fit in the intention of dental insurance. And in looking at it, we're really going deep this year to find ways to align more with the patient, become their advocate, standing with them in their space on what's best for them.
Exactly. And as your providers, as your dentist, as your hygienist look at treatment planning for your patients, it's based off of their clinical findings. And I make a joke of this, but I am sincere with it. I have yet in my 36 years seen any dental insurance company representative show up to a comprehensive exam for a dental patient. So to allow a third party who is honestly not involved in the healthcare portion of your health care to drive your decisions versus trust with the providers who do know you, who do know your clinical findings, who are educated in this world, we get off the reservation a little bit that way.
Yeah, I mean, 5 thoughts came to mind when you were just saying that, which would bring me off the reservation. But one thing that's really important when you said that is the fact that I think my job as COO and lead of Babylon Dental Care in 2026 is to help create tools for my team to talk to our patients like that, where I don't want to bash their insurance companies. I don't want to tell them if they really feel that they need that coverage. I'm more than happy to help them with it. But I need them to understand that it's not us versus the insurance company versus the patient. It's actually we're standing with the patient.
Absolutely.
And oftentimes it's the patient and BDC against the carrier, because I just can't advocate, again, holding Cliff's original vision of treating people like family, creating an experience that exceeds an expectation. I can't advocate for any one of our professionals, including a patient coordinator, including a hygienist, including a doctor, to promote or give care that is not in the next best interest of that patient. It just doesn't flow with who we are.
No.
And, I look at Cliff's career and I realize that I don't even think he could stomach it.
No.
If I asked him to do that.
It goes against everything that Babylon Dental Care believes in. It would erode trust immediately, and trust is the foundation of your relationship. As COO, you have selected someone who is equally passionate. You do the right thing because it's the right thing, not because insurance does or does not pay for it. And so you can flip that coin either way that you want, paying for doing a treatment because insurance will pay for it when it's really not necessary medically or clinically, versus not doing something because it is necessary, but not doing it because insurance doesn't pay for it. Both erode relationship, both erode trust. In the center of all of that is a patient who what we do, what happens in their mouth affects their entire body. Science is extremely clear. What is in the mouth affects the heart, Alzheimer's, colon cancer. I mean, the list is a mile long. And so when we look at keeping the mouth healthy, it is indeed my belief system, if we can get the mouth healthy, the body will follow. Now, nutrition, exercise, appropriate care, without question. You don't buy a car and never have the oil changed. You take care of yourself. You align yourself with providers. You make relationships with providers who are committed to the same thing you are. And you stay with them and they watch after you. in medical, so often we see this. Oh, I believe everything my doctor says. Dentistry is elevating itself in the position of major health care. Get the mouth healthy, the body will follow. You cannot have a healthy body without a healthy mouth.
So we went a little bit into the insurance topic, but it's all interrelated here. The one thing that I do want to spend some time talking to you about is your whole body positioning with dentistry. It was really amazing to me. I think maybe your second or third visit to our practice, we had a team dinner, and it might have been with was it the doctors?
With the doctors, it was.
Thank you for reminding me. My brain is shot. And then you started talking about it, which blew my mind. And a few things before we even go into that, just, as we're talking. Yeah. One of the things that I've been passionate about is probably about 12 years ago, my husband, Dr. Cliff Brown, decided that he wanted to pay attention to sleep apnea. And back then, no one spoke about it.
No.
Nobody knew what it was.
It was not acknowledged.
It was not acknowledged. But true to Cliff, wanting to treat people like family, he had a lot of people that were suffering. And he learned about treating the sleep apnea with an oral appliance. He learned a lot about a CPAP machine and how invasive and actually not the best way to care for a mouth, right? For sleep apnea. So it was almost like a side passion project for him. He was like, oh, I'll make oral appliances. He connected with Dr. Moses, and he started that sleep apnea journey, right? I think in the beginning he might have did some snore guards, but not too much.
Okay.
And I remember I at that point I was director of marketing, and he tells me he wants to do this, and he's like, because we're go-getters. That's our whole relationship, go-getting. Build out a new website. That point, there's no Google searching. There's no AI. Legitly, he hands me the Dr. Moses book, and he's like, and I'm content writing. I legitly read this back forth because, again, when I hired a web company, they didn't even know what sleep apnea
didn't know what it was.
The woman that I was working with at the time was like, Jenn, I'm learning so much. I think I have it. My husband definitely had it. I said, yeah. You read the content, everybody has it.
We'll make an appointment for you.
Exactly. So here I was, and at that point, again, there was no providers on Long Island doing it. So we go through the journey and we do it, and we go through it. We have friends that, come to us, blah, 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 blah. So all these years later, now he has an airway health department. We have an airway health director who's a former hygienist. I'll be meeting with her next month on the podcast. We have someone who specializes in our billing department. Yes. We have an assistant that just sees airway health patients. It's a whole department. Right. And the flow of patients that come through there and how they're helping them, it's really inspiring. Fast forward, you come into our world and we have this dinner and you start talking about whole body health and another piece to what we already were building out, Yeah. And that was so exciting. So I want to talk to you a little bit about that because I learned so much at that dinner.
Oh, wonderful.
I was so inspired and jazzed about all the things that we can evolve to, to help patients even further. So let's talk all about that.
Yeah. So that dinner that night, one of the things that we kind of broke topic on is saliva testing. And I speak real plainly about this because it just is a topic that deserves no confusion. Whoever you're swapping spit with, you're getting their bugs.
Oh, yeah, fun.
There you go. So there is a thing about who you're kissing, and never kiss a baby on the mouth, please. But no, your saliva will hold both good and bad bacteria, and it's important to know which. You swallow 900 times a day at least. Where does that go? Right into your stomach, right into your gut. It is no surprise gut health drives your healthcare bus. Now we get into, okay, what else happens? We have a little bit of bleeding in the gums, right? Now where does the bacteria go? Wherever your blood goes, your whole entire body. So the connection between whole body health, bacteria, again, very clear. And it took us forever in the world of dentistry to get acknowledgement for the mouth and the heart connection. Faster, in a faster pace, the connection to whole body is now coming from the saliva testing side of things.
I mean, that just sparks so many crazy stories through my journey, just being married to a dentist, because, I'm married to a dentist, and believe it or not, every weekend I get phone calls from our friends. Can you ask him this? Can you ask him that?
Yeah.
One of those phone calls came in that a friend of mine, her mother had an oral infection. And Cliff was like, listen, go immediately to the oral surgeon. She was swollen.
Now.
Yeah. Went to ER, got a prescription for an antibiotic, wrong strain. She died in 48 hours. Now I used to want to help my friends and give advice. Now I stay away from it because I say I have no qualms. I tell that story. I'm like, no, don't go to the ER. They don't even know what strain of oral infection you have, and they don't know what the proper
protocol would be.
Yeah, or sometimes those infections have to be drained.
Exactly.
I mean, it's beyond ER. I mean, listen, Stony Brook does have a school, NYU. They potentially can have a dentist treat an oral infection that comes through the ER, but most ERs don't have that availability.
No, and they're going to be ERs for, let me get you out of urgency, let me get you out of pain, let me get you an antibiotic. It's not treating the problem, it's treating the symptom. I'm so sorry for the loss of your friend, number one.
Thank you.
But no, that speaks to the validity of the mouth is so much more than just teeth. And we could go off on many tangents of, how do teeth support the face? How do how does it support the tongue? How does it help you breathe better? But something of that nature, go now. Don't stop. This is, saliva, bacteria, you need them both, but you need the proper ones in proper balance.
So let's talk about that saliva testing, because you did, all of my doctors lit up that night hearing this, because
the lights came on.
They've been hearing discussions of this in whatever they're following. But one of the things that you said that night that I saw my periodontist's face light up was you mentioned something about say someone needs an implant.
Yes.
And there was some marker you mentioned on a saliva test that would be able to indicate to the doctor and or the patient that took the saliva test that the implant may not take and fail based on... I'm sorry, I'm speaking
implantitis.
I was paying attention, but all the verbiage is failing me at this moment. But can you just, because that was very interesting.
It is anytime before. I mean, my belief system is anytime before you place an implant, you want to have a saliva test. Peri-implantitis is going to give you a risk assessment on that, and if your risk assessment is anywhere on this scale, especially if you get into the moderate or high, let's treat bacteria, because there's going to be bacteria above that show PG, TF, TD. There is a jillion of them, but those are going to affect the gum tissue. They will affect how tissue, how bone can respond. And without bone responding appropriately, I don't care how great your implant is, it's not going to stay.
Right.
And so, it was a fun, but all of those. And so if you're looking for an implant, peri-implantitis is what we're looking at there. But the bacteria that's going to affect that can also affect many other things. And it gets into pregnancy, adverse pregnancy outcomes from certain bacteria. So women who are in your practice that are pregnant, saliva test. Then we get into, my belief system is every patient deserves the right to have this test offered to them. And so we're working with that right now. You've been very strong in that advocacy of getting that into your practice.
Well, I mean, listen, I think it's a no-brainer. I don't remember the fee involved, but I think it was
it's like 145-ish, something like that, 165. It's from where I stand, the least expensive test that you can get that's going to give you a broad spectrum look.
I think that's definitely doable for people. I mean, I think my daughter might spend more on Starbucks a week.
Yeah, many do, and and we're feeding bacteria at Starbucks.
Yeah. But it's a no-brainer, and also the other thing that I liked about that conversation was the fact that it would benefit us to know that what we're doing in care is actually, we're moving forward in sustainable, healthy care.
Exactly. You don't know what you don't know till you test for it. And there are different, many times patients will say, oh, it's just a cleaning. It is never just a cleaning. You're taking care of things that are connected to your whole body. Let's test, know that we have the appropriate cleaning, quote unquote, hygiene care, and watch those bacteria become non-detectable, which in turn gives you a healthy mouth.
Yeah, I'm very careful about when I do oversee or work with my marketing department on language on anything, because they have seen here and there cleanings, and I like to avoid using that word because I think the statement says something to a patient that isn't even there. And listen, we know there are, biannual, twice a year, those are hygiene visits. And then we also know that there's deep hygiene.
Periodontal maintenance therapies. To some degree, we clean our teeth each day with our home care. Hopefully we're doing home care. We have to do more than that, and it takes the experts to see that. It takes gum evaluation, bone evaluation. People love perio charting, where's our pocket depth? When pocket depths continue to increase, we're losing bone. When gum tissue is infected, we're losing bone. It doesn't come back. We chop off our finger, we don't grow it back. We're not like the lizard tail. So keeping gums healthy, again, what bacteria is at play in there that's going to affect not only just your gums, your teeth, and your whole body.
I love it. I have a trainer slash nutritionist that I've worked with for 9 years. He's great. And young guy, loves everything about learning about total wellness. Loves it. And I keep kind of nudging him because I tell him as a trainer, you want to create a relationship with your clients that it's not necessarily about them coming in and maybe losing weight. That's a short-term goal, right? You want to, yes, everyone who comes in wants to lose weight.
Yeah. That's an objective.
That's the when they first come in. Then you want to transition them to the long-term goal, which is, fitness and wellness. I mean, it's
overall wellness.
Peter Attia. I mean, he's
Peter Attia.
Yeah,
Love
he's
him.
constantly talking about, when you're 74, what range of motion do you want?
Right.
How do you want to show up for your grandkids? Do you want to be on the floor with your grandkids, or you want to have to sit on a high chair because you can't get down with them?
Bend down.
And there are things that we can be doing now to, again, we may not ever expand our life beyond the day that we're going to unfortunately go, but how are we living in the moments up until that day?
Right.
Physically, mentally, spiritually,
Absolutely.
So I'm always nudging Marco to think about connecting more of a whole body. I said, you need to connect with Cliff. You got to get people to deal with airway health. There's so much more. I mean, he deals with the nutrition component, which is super huge. He's great on the supplement component, super huge. But the other aspect is the airway health, oral wellness, he's got, for instance, he's got a lot of clients right now on GLs.
Yeah.
Ton of people on GLs that actually aren't going to doctors to regulate being on a GL.
Yeah.
You know, which, by the way, I think that at some point everyone's going to be on a GL for other reasons.
Or the body will make it itself.
Yeah. Other reasons than weight loss. But,
yes.
you know, you should have a healthcare provider walking you through the GL journey.
You should have a healthcare provider overseeing your health care.
Right.
And one that you can trust, one that is well integrated into what you as a patient want as your goals. You talked about, you know, how old are we going to be when we're 64? You can be 85 chronologically and still be able to function as though you're 60.
My dad stopped figure skating at 85.
Beautiful. Look at that. You want to live your life.
He looks awesome. Yes. I want to have his genes. I hope he's really my father. No, I'm kidding. I hope he's really my father. But he stopped skating at 85.
But he skated till he was 85.
And by the way, he was still skating. He wanted to skate. He had taken 3 falls. And his birthday was coming around, and the gentleman who made his skates, like he has custom boots and blades. Right. It was going to be his birthday, 86 this past year. And I called the guy, Dante. I said, "Can I get my dad? He needs new boots." And he said to me, "Oh, Jen, he really should hang it up. You know, you get to an age where it's just."
Risk factors.
He did take 3 falls.
Yeah,
so
risk
now
factors.
He's in chair yoga. But you know,
he's still moving.
He's still doing something. But if that didn't happen for my father, he would have still skated. And he looks like, if you saw him,
fit. Yeah.
And that's how he's showing up.
Yeah.
I love it.
And that's how we want to show up later in years. We want sure, chronologically, we can't change the pace. We can't change the numbers. But how we show up at that age can be altered. And healthcare all the way around is a huge, gigantic player in that.
Yeah.
Huge.
Love it. Love it. One of the things that I'm very excited for, you know, because I'm always meeting people and motivating my team.
Active.
I'm very active and giving team members direction and all that stuff. One of the things, though, I'm saying a lot in the last probably 6 months since you and I started working together is I am very excited for dentistry because I know we're talking about concepts that aren't really mainstream in every practice or signed into law, so to speak.
Yeah.
But mandated, correct. I really believe that all these things that we are talking about are going to start coming through dental schools, being spoken about, mandated, being brought across state lines to dental practices. That's to me something I'm feeling very strongly about.
Well, the more a patient will ask for something, the more available it has to become. And so, for instance, Babylon Dental Care, you guys are committing to things right now that are not mainstream. They're starting to be talked about, sleep apnea. But how much does sleep affect? You get 1, 2, 3 bad nights of sleep. How are you functioning? How are you showing up, right?
I had my grandson for 9 nights. He was 6 months. I love Jack, but I was up every 2 to 3 hours.
And it affected you.
I was daily delirious.
Yes.
I mean, I got over it because I recalibrated my system on night 3 because I had him for a long period of time.
Imagine a lifetime of 9 nights.
I can't.
No.
I have to have 8 hours.
Yes.
Honestly, you don't want to talk to me if I don't have 8 hours.
I understand.
And you've not spoken to me though.
No, but I'm the same.
Yeah.
You're talking to someone who, for the majority of her life until about 7 years ago, lived with sleep apnea unknowingly. Because here's what happens. Doctor's office. How are you sleeping? Good. How do I know any different? That's all I know. I know now my sleep was horrible. It was awful. But now I sleep very well. So Babylon Dental Care, you guys have an entire sleep department you're committing to. Myofunctional therapy is coming on, which is tongue tie related.
And by the way, when I told my sleep director about Jack, she's like, he's got a tongue tie.
Yep.
I mean, I'm like, all right, call Josh. Let's work it
Almost,
out.
you know it. Yeah. And yes, to our audience, yes, adults, you can have tongue tie as an adult. You are born this way. It's not something you gain as you grow older. It just wasn't diagnosed. And that's another thing that Babylon Dental Care is doing. We are expanding what we look at. In traditional dentistry, tongue tie is never looked at. That is how I, at 63, learned I was tongue-tied from the day I was born. Is my dentist is that dentist who does comprehensive. And so my experiences in my own life drive a lot of the passion that I hope to bring to you all. And as COO of your Babylon Dental Care, you guys are adopting these things. So we're talking to patients about things they don't even know. And you will hear, well, no one's ever told me that. This is true. Because a dentist can only diagnose to the level of their education and how well they can see. And so those two factors will make a play in what a patient is opened up, what their arena is. We are working to expand that arena to things that encompass their whole body. And
I mean, listen, we're just starting this process of really branching out. Yeah. And as I'm talking to team members, you know, they're a little hesitant because they're nervous that the message is going to fall on deaf ears, or someone may not want to hear it, or, you know, might make it uncomfortable for them. But my belief is, let's have ownership of it. We'll talk to everyone who's ready to learn, and we go from there. I mean, listen, it's the same thing. You know, I'll have my friends over to the house. Some of them will love that dish that I make. Some of them won't. And okay.
But that doesn't mean they're not your friend anymore.
No,
they're still your friend, and they're still going to show up for the next dinner. Yeah. No, I'm a believer that when the teacher is ready, the student will appear. And so, or when the student is ready, the teacher will appear. Let's go it that way. And so we can open the door. Just open the door, put your toe in the water, and just ask a couple, sleep questions. Are you sleeping through the night? Are you dreaming every night? Do you wake up feeling like, oh my gosh, I want to go back to bed? Those 3 questions, let's just talk about those and just open the door.
And you know what I've been asking? What time were you up?
There you go.
If you tell me the time you're up, we have problems. My belief is if someone wakes up enough to look at the clock, you have a sleep problem.
Right. Well, you have a breathing problem at that moment because the body is actually designed to go into sleep paralysis. Think about caveman days. Back in those days, if you hustled about in the cave, whoever's outside the cave, whatever's outside the cave is going to eat you. So we are designed as humans to actually go into a sleep paralysis, if you will. Our functions actually shut down. Only the necessary things keep going. And so when we find someone who's rolling over and saying, oh, I woke up at 3:30 this morning, looked at the clock, I'm tossing and turning. There's something there. It's a message. Let's explore it. Let's look at it. Because that's going to turn into a 3:30 in the morning and a 4:30 in the morning, and I never got some sleep, and now I'm a grumpy bear.
So one of the things that I did the last quarter of 25, I don't know if you've been in the practice a few days now. I don't know if you've heard this. I'm making it mandatory that we sleep test. Did you hear this?
I did yesterday.
Team member?
I was so excited.
When I dropped that at a staff meeting, you had to see the face. And by the way, I'm not asking, when we started sleep apnea, let me explain to you. We always did home studies.
Right.
That was our we were linked with hospitals that built
the clinics where nobody ever sleeps in.
multi-million-dollar clinics, and we went that route for a while. And then when I found a company that does take homes, I got it. It was a box like this.
Yeah.
And I remember a dear friend of mine, I gave it to him, and he was in my car. We were meeting. He gets in my car. I give him the box, and he gets out. He goes back to his office. He calls me immediately. He's like, "Where are you?" I said, "I just went to get some yogurt." "Come back. Did you see what's in this box?" In all honesty, I really didn't see what was in the box. It came with a sleeve shirt, multi You know what I'm talking
notes.
about?
Yeah.
This
Like trigger.
here.
Yep.
So I was giggling. I'm like, all right, we came so far. He could take it home, but it's this still
It's going to sit in the
chaotic.
cabinet.
Yeah. So I think he said I think he did it 2 nights in a row. Maybe we got an hour of read off of him. It was
gosh.
very funny, but everyone's face dropped because that was the take home that I always was talking about. Now it's a ring.
It's a ring.
It's a ring.
So
they
easy.
Sleep with a ring.
Yeah.
But anyway, when I dropped it, I thought was the dumbest thing I've done as a leader. Dumb. I really did. I thought I was going to, they wouldn't ever outwardly coo me, but I felt like inwardly they were going to be like, all right, she's definitely lost it. They are so grateful.
They're so excited.
And I'm like, how did this even happen? We've had a sleep department for 13 years.
Yeah.
How did...
Because it became personal.
But that's how much sleep and someone's mental relationship, relationship to their own sleep is so off kilter.
Yes.
These people work in a practice where they all at some point have mentioned Dr. Brown's sleep practice.
Yes.
But yet they don't recognize their own sleep issues,
right?
To even, I was just, this has been very exciting. So I think we've done more than half the staff.
Right. That's what Michelle said.
We're helping people. And
yes.
What a great feeling that we're helping our own first.
Well, and
how did I not?
Well, because
why did it take so long to
figure this out? We got there. It doesn't matter why, but we got there. But no, and what I saw yesterday when I learned about that is your team is talking about it. Those that have had their reports, they're talking about it. And now when it's been my story, I can share my story with my patient. And just this morning, one of your hygienists, I've done this sleep study. I can tell you all about it as she's talking with the patient who needs one.
That's what I want to build for everyone. I just don't want to have a team of professionals working with us that are selling dentistry. I say this all the time. I'm not a let's sell dentistry. No. Let's share it. I remember doing an interview with someone during COVID. She was coming from corporate. And my first question is always, why are you looking for a new opportunity? And she was like, and during COVID, we were open for emergent care. You were only allowed emergent care. But this practice was actually pushing, they were open for emergent care as well, but they were pushing them to sell adjuncts to make money. And she's like, I got a bad taste in my mouth.
It sours you.
And I said to her, look, I believe we're the opportunity for you. The one thing I can promise you in your tenure with us is we're not going to talk to you about selling dentistry. Yeah. We're going to talk to you about sharing dentistry. Again, I always go back to those fundamentals. That's treating people like family. Exactly. That's creating an experience that exceeds an expectation. I don't need to sell dentistry. No. I'm here when you're ready. I'll help you.
Favorite saying.
And if you want to come 10 times in and out of the practice and not address your sleep and, on your airway health screener in hygiene, if you want to flag high for need and you want to ignore it, I'm okay with it. When you're ready, we're always here for you. We're never going to, make you feel bad or not welcome you.
Right. The
or
door's
say,
always
I told
open.
you so. I just want to help people, but I really want it to be when they're ready to step into that journey.
Right. It's their body. It has to be their choice. As with anything in life, you don't want to force something because it's putting your belief system on someone else. What we can do, each time, each touch point, let's offer another point of education. Let's offer something of value to that patient. It will stay with them and it will be with them. And then that day will come when they will be ready, and now the conversation is open.
Well, talk to us about wellness scans.
Yeah. Look at that. Is that not the best thing? It's so fun to see our healthcare system has been so sick driven for so long. And now these companies in the last yearish, 18 months or so are coming out with preventative. Let's look before there's a problem. Let's find something before. Get your MRI scans, get your CT scans as a health care. No, this isn't something you can go do every 6 months. But what a thought. Let's get it before. Let's see if there's anything there. What can we do to help you improve your health before it needs help? And I'm just so in love with this idea. It just thrills me.
Yeah, me too. The wellness scans have been really unbelievable.
Yeah.
And now I think we've been doing them for about a year and a half, 2 years, and they really start showcasing things when you have the first, the second, the third scan. Yeah.
Get them now. And that's if we can shift the perspective of what dentistry is perceived to be and move it into the position it to where it is a healthcare tool designed for long-term benefit. Yes, teeth will be cleaned every 6 months, every 3 months, every 4 months. There's so much more in your practice that can guide people to whole body health.
Yeah, I believe so. I'm excited
there
about
is.
it.
And that you all are going out on the limb, that you're trusting in that you're educating, open those doors to your patients. That is phenomenal.
So one of the prompts on my card was to chat about what makes Babylon Dental Care special or unique against other dental practices. And, before I stepped into this position to help Cliff and his organization, I was a dental consultant for years, like you. It's a fun place to swim in.
It is so fun.
But I know, and I try to celebrate it with my team as much as I can, because I do think that it's not easy to adopt this service space that we're in, because it's much easier to just do the flat,
come in,
minimum.
come out, do the bare
100%.
minimum.
100%. But so in working with us, what would you say our special bells and whistles and unique abilities are?
Oh, gosh, we don't have enough time for all of them, but let's hit a few top ones. The fact that you even want to invest in your team, invest in their education, and then your team is accepting that. And just today, I walk into one of the offices today, and they're like, 3 or 4 people are all excited. Let me show you what I've done. Let me show you what we've done from last time. That is huge, that you want to have time with your patient, that you want to sit and let's plan this. Let's talk about these things. Your team is having a shift in their own belief systems. Many of them have been in dentistry for some time. They've been where we've been. We've seen the evolution. It's only that we've taken a different pathway. I could have continued just, the traditional way, but ventured off the reservation, if you will. They're venturing, but in that process, their own belief systems are changing. So what you teach them, what you're investing in them now, is also for their own person, for their own family, for their own children. And now they see the benefit of that. They're able to believe that. So when they speak with a patient, it's more of, may I share with you my experience here? Let me share how this helped me. And we're not selling anything. We don't need to sell anything. We just need to open that door. And you're doing an amazing process there.
That's great.
I love your teams. I do. I so love their energy, and they are like sponges, and they just want to soak up so they can learn and share.
They really are. It's hard to, and I'm a very descriptive character. It's hard to describe it though to other people, because there's a professional component, there's a human component, there's a spiritual component, there's an energy component. They're very energetically aligned to goodness.
Relationship.
It's really great. Oftentimes I feel so blessed. I drive to the staff meetings I told you earlier, and I do. I open it up and say, give me the words to serve. I get there. I deliver messages that I feel called that they need. And I'm there. And let me tell you, I'm hit by 1,000 things after those staff meetings. And I have a lot of fires to put out, a lot of thinking for people, a lot of holding space, a lot of energy depleting moments when I'm in the practice at times. But I get in that car and I feel so good. and joyful about the time that was spent with them, they really blow my mind.
Yeah.
And every we had an opportunity this week where we definitely, I'm going to say, failed a patient, and we could have done something better. And the patient brought it to us. We immediately got leadership involved. We got the key players involved. We had a teachable moment conversation. I'm a big believer in, when something like that is presented to us, it's there for a reason. We're gonna fail forward on it. We're gonna learn it. We're gonna talk it through with the people that were directly involved, and then I'm gonna bring it to everyone else so we all can learn the message. And this week we dealt with this. We rectified the relationship with the patient. She's still going to another practice, and I'm fine with that. I sent her flowers and thanked her because, truthfully, she
helped us.
Oh, yes.
She helped us.
If I would have set up 1,000 trainings, I could not have gotten what we got from her.
Right.
I mean, unfortunately, she was sad and didn't get what we needed, what she needed from us. That makes me very sad. But it's the way that it was meant to be. She may come back, she may not.
The door is always there. As long as she
gets the care she needs by someone, I'm happy. But what it did for the 6 people that were directly involved, and then what it will do when I bring it to the whole team, is going to be amazing. Yeah.
And the fact that you do that, just even the fact that you take it into the context of learning, it could go into blaming context and you get nothing out of it. But it's a learning context and your team wants to learn. And everyone, like you mentioned, the 6 there, they've all learned. We've talked about it again today even. It's a process.
Right.
And we own where we are, and that's maturity, and that's honesty, transparency. No one's perfect, and we always want to learn every opportunity we can.
I agree, which is exactly why we want to do this podcast.
So exciting.
It's a commitment.
Yes, it is.
A little anxiety producing.
Yes.
It's a commitment, but we're going to go with it.
We are going. We're on that. We're out there on the limb.
So as we wrap, we learned a bunch of things. Let's not say Happy New Year after the 7th.
Not after this. That's new to me. Did not know.
Gosh, Larry, David,
And here I am wearing white after September.
It's
so there
all
you
good.
go.
It's all good. Anything you want to throw out there to patients that might be listening? I don't need you to promote my practice, but just promote overall dental wellness, if you could.
Yeah.
And then also if you could say a little something to my team, because you've been in the practice a bunch of times and you've seen where we're going and who we are and what they're doing. If you could give a little wrap up on that, I'd appreciate it.
Thank you. I would. For patients, please keep in mind that dentistry is the window. Your mouth is the window to your body. And it is deserving of care and attention from providers that you trust and are aligned with your values. People that are willing to spend time with you and educate you and treat you where you want to be treated. It's your body. It's your choice. Babylon Dental Care is, you guys are there, and we're going even further in that realm. To your team, appreciation is not a strong enough word. Their willingness to trust in someone they've never met, in a vision, in a belief system that is very new to those who have been in dentistry, and to adopt that so willingly and be so supportive in the end desire of serving your patients. And serving is a key word there. They want to be of service, as do all of your doctors, your leadership team, yourself. You lead with belief. And so it is, I am inspired each time by everyone that I get to work with, because I learn and I see that what we do together makes a difference for a whole third party. And we can have a healthier body, a healthier mouth, one person at a time.
I love that. Thank you.
Thank you.
I told you before we started that, You know, if Deb would have asked me who I should start with first, I would have said Angela Ward. I'm just blown away by that. I only do what Deb tells me to do.
And Deb, keep telling. I love it. Thank you.
I really, on a personal note, I'm so grateful that the first podcast we can chat like this.
Thank you.
I'm really honored for the time that we've worked together thus far, and I'm very much looking forward to continuing our relationship and learning from each other and doing things together and having margaritas, because those were good last night.
Those were good. They were good.
Yeah.
Now, we have many, many new frontiers waiting. And, there are the settlers and there are the pioneers. And absolutely pioneer. You are a pioneer. You're Babylon Dental Care pioneers. Let's move in that new frontier.
Love it.
Thank you so much for this opportunity.
Thank you. Thank you.